And good morning. It's Tuesday, December 12th, 2023. I'm Dr. Deuk. We're broadcasting live from the operating room at Deuk Spine Institute, Surgery Center, Viera. Our patient is from California. He travels here because he has a herniated disc. We call it a bulging disc. It's not big, it's a small herniation, but he has horrible pain in the neck right at C5-C6. The MRI shows a herniation at C5-C6. It's a small herniation, more of an annular tear with a bulge, and that's where his pain's coming from. He doesn't have any facet joint pain, and he has no pain anywhere else. So I've isolated the source of his pain to be the C5-C6 disc. Now, most doctors just blew him off in California, gave him pills, told him to live with the pain. They said to him, you're going to need a fusion done in a few years. Come back in about 3 to 5 years. His thought was, Doc, I'm in pain now. I'm in so much pain, I don't want to live like this for 3 to 5 years. So he found Deuk Spine Institute. He saw the laser surgery we do to repair these discs that are damaged. And here he is today, having his surgery done. Let's count on the lateral x-ray, Henry. That's C2, 3, 4, 5, 6. Did you get that, Henry?
Yes, we did.
So we are at C5-6. You can see the disc is well preserved height-wise. It's not collapsed, it's not degenerated, it's just herniated. Now we're about to do our discogram, and hopefully we'll see a tear in the back of the disc. That's the tear we're here to fix. Shot? There's the tear. You see it? Shot?
Yes, we do.
Perfect. All right. Let me do one more shot as I'm injecting. You ready?
Yes.
Shot. All right. Well, I was hoping to see the tear better. You can actually see the tear right there, right where the arrow is. And it makes a little wave and goes out. And then you can see the herniation. Show us the herniation there. It's actually the little gray area. Yeah, right there. So he's got a small herniation, but he's got a big tear. And the tear is what we're here to fix. That's where the neck pain comes from. Shot. All right, you can actually see the tear there. Show us the tear on that x-ray there. It's like a little wave up and down. Yeah, it almost looks like an EKG pattern. Shot. We've got the guide wire in at this point, and shot. We're going to inject a little bit of our local into the skin. This surgery you're watching is called the Deuk Laser Disc Repair. It's available here in Florida at Deuk Spine Institute. It's not available anywhere else in the United States. And this is a repair of his disc that's causing his neck pain. We're going to numb the skin. Unfortunately, if you go to the doctor today complaining of neck pain, they're going to tell you to go to pain management, go to physical therapy, take pills. They're going to give you these suggestions such as chiropractic, physical therapy, massage, acupuncture, cupping, pain pills, anti-inflammatories, narcotic, opioids, muscle relaxers, nerve agents such as Neurontin, pregabalin and gabalin. Point is, none of those treatments fix this pain, none of them. Now, the pills will make it feel better for a short period of time, but they will not cure the pain. The only surgery that will cure this pain is the Deuk Laser Disc Repair or a spinal fusion. Nothing else works. So this patient did not want a fusion. He was not even offered a fusion. His doctor said, wait 3 to 5 years before you get a fusion. We've made a 4 millimeter incision in the skin. I'm now going to remove the needle. You can see the guide wire is sitting inside the herniation at the tip of the guide wire. Show us that. Right there. Guide wire has been placed. Now we're going to bring the dilator. Can you see this, Henry?
Yes, we can.
Notice the taper tip. It doesn't cut muscles and soft tissues, it spreads them. So we're going to slide this dilator down the guide wire. We have to be careful not to advance the guide wire as we do that. Shot? It's going quite easily. Shot? Beautiful. By the way, we just passed to the side of the esophagus and trachea. Will you show us those tubes there, Jordan? Yep, there's the tracheal tube, and there's the esophagus. Shot? Now we're at the front of the spine with the dilator tip. Let's get an AP X-ray view to see, make sure we're in the midline. Straighten the neck, please, and the head. Shot? Perfect. Oh, wow, that's a great picture. Stay there, Jordan. Show us the anatomy. You can see a tear on both sides of the back of the disc. One there and there. And show us the nerve root that has dye around it. There it is. That's actually the nerve root. So you see the tear is just below the nerve root. Show us the back of the tear, yes. And show us the nerve root, the highlighted dark color. Yep, beautiful. That's going to be your C6 nerve root. That actually may be, it's kind of hard to tell based on the parallax, but that may actually, I think that is the C6 nerve root on the right. All right. Any questions?
No current questions.
Let's go ahead and show our audience how this Deuk laser disc repair, why herniated disc cause so much neck pain. Welcome back. So one thing I've noticed as we're advancing the working channel over the dilator and trying to put it into final position, I notice the disc is under a lot of pressure. That's from inflammation. Inflammation, remember, is, as you've seen in this video that you just watched, is the source of the neck pain, the headaches, even the arm pain. Okay, so far we've lost 1 drop of blood. You guys see this here?
Yes, we do.
We've lost 1 drop of blood, and that's all we're going to lose for the entire surgery, 1 drop. So this is a bloodless surgery and no scar tissue. You can all see here the incision. You see that, Henry?
Yes, we do.
4 millimeters. That's all. Just a little cut on your neck, and the patients go home the same day. We're going to get started. We're bringing our laser in with the endoscope. We're going to turn the irrigation on. We use irrigation throughout the surgery. Irrigation does several things. Number one, it removes any type of blood products inside the disc, but it also irrigates the pieces of herniation like this stuff right here. It irrigates it up and out. It brings it out of the tube so we can get it out of the patient's body. There's the fiber. Now, for those of you who've not been here before for these surgeries, that fiber is 550 microns. 550 microns wide, the glass part. You guys see the clear part there? 550, which is half of a millimeter, for those of you who don't deal in micrometers. That's half a millimeter. So just to give you an idea of how magnified things are. We're actually magnifying and illuminating everything down here at the back of this disc. But you can see things are on a small scale. They've been magnified so you can see them better. And that's how we do the surgery. Okay, here's a piece of herniation. You can see the laser is vaporizing it into little pieces. It's disappearing in 10 minutes. No, that's fine. I'm not worried about the switches anymore.
No, but I'm saying is I'll
Oh, okay. Why, are you having some?
No, it's just I gave him a 45-minute shot
Oh, okay.
20 minutes ago.
Yeah, but I didn't know if you were having trouble ventilating him.
No.
Airway
There's
resistant.
just going to be a little time for me to wake up.
Yep.
Just to get that
Yeah.
deeper relaxation.
No, we only need 10 minutes probably. Okay. Any questions from our audience as we remove these pieces of herniation with the laser and repair the tear at the back of the disc?
No current questions.
Okay. Well, today is a monumentous day for our project in Orlando. The plans from the architects and engineers will be finished today and ready for submitting to the city for permits for our new building in Orlando. Yeah, thank you.
Does the city take a long time with them, or
We don't know. I mean, the city will take a longer time evaluating them if they're not done properly,
right?
right?
That's
So
like, yeah.
that's why you want a good firm that knows the city and can
Knows what they're doing.
provide plans that the city will approve quickly, you know, first time doing it.
Does the firm build a lot of surgery centers and ambulatory care?
They do, yeah. The firm is a reputable architect firm that does all the big hospital projects in Orlando, all the medical healthcare projects. There's other ones, but this is the one we went with, and I like them. Good group of people. Enjoyed working with them. They seem quite professional, organized. We were originally supposed to have these plans a month ago, but, you know, things happen, and you do the best you can. All right, Henry. Well, for those of you watching and learning, as we do this single-level cervical Deuk laser disc repair for a herniated/bulging disc in the neck, patient's having pain. He's from California. Henry, why don't you show us the video about how this surgery actually works to help these patients avoid fusions and other invasive treatments or live with prolonged neck pain. All right, welcome back. You can see how the Deuk laser disc repair debrides the herniation and the annular tear. And I was just talking to Henry. These are fibers of the posterior longitudinal ligament. That's what you're seeing. They run left to right, which is down to up or up to down. Henry, will you get a nice picture of those?
Just did. Copy that.
All right, this will be good for our website. Now the question is there any herniation back here? You can kind of see where the herniation went through the fibers. We've cleaned out the foramen on the right. It looks good. I'm going to take a look to the left one more time. And then we're very close to being actually done here. See, this is all looking healthy. It's really the right side that the patient had a real problem with. And once again, this disc was under a lot of pressure. I need about 2 minutes left, doctor. That's the foramen, the neuroforamen you all hear about. At C5-C6 on the right, you can see the dye, the blue stuff, how it escaped out the foramen. You can see the torn annulus right here, the annular tear we showed you in the previous video. And I'm just cleaning all this stuff out of the foramen. We've already removed the herniation out of there. I don't really see anything more. It looks good to me. I think we're done. Okay. Let me just clean a few more of these edges out. You can see this is the annulus tear. It's white, it's frayed. There's some scar tissue right here from the inflammation. I want to clean that. I got about 1 minute left. Any questions from our audience?
No current questions, but we do have a comment that has come from Steven on YouTube.
Welcome to our live stream, Stephen.
They said, "Good morning. I know you have said in the past that people do come back to comment on their successful procedure. I think this would be great if you could arrange this for people who are on the fence. Trust me, I'm not on the fence. I'm ready to get my quality of life back. Thanks for the hope. Kind of herniated with core compression if left too long because of forms peripheral neuropathy. Sorry, it can be a herniated disc left too long with core compression. Oh, cause peripheral neuropathy."
Yeah, herniated disc cannot cause peripheral neuropathy, just for your own knowledge. Peripheral neuropathy is due to damage of the small nerve fibers in the periphery, hence peripheral neuropathy. It's always due to a chemical abnormality, whether it's diabetes, high sugar, destroys the small nerves. Could be chemotherapy that causes it if you had chemotherapy. Could be a folate deficiency, B12 deficiency. There's a variety of causes of neuropathy, but a herniated disc never causes neuropathy. Never.
Sitting down, please. Thank you.
Now, there's also the type of neuropathy called carpal tunnel syndrome and ulnar neuropathy, which comes from compression of a peripheral nerve in your wrist or elbow, not the nerve root. The herniated disc can only cause radiculitis, radiculopathy, or myelopathy. It cannot cause peripheral neuropathy. Irrigation? So you've got something else going on, my friend. And if it says median nerve neuropathy at the wrist, that's carpal tunnel syndrome. You need a carpal tunnel release done. And if it says ulnar neuropathy at the elbow, you need an ulnar nerve release at the elbow. Okay, we lost literally 1 drop of blood the entire surgery. And I'm going to show you right now the incision. What's this for?
Oh, no.
Oh, okay. Yeah. Give me 1 second. Blood pressure is good. Yes. Patient is waking up. Our patients are asleep. They have a tube down, general endotracheal anesthesia. There's no other way to do this surgery, in my opinion. If you go to Korea, they'll do the surgery with you awake. And they don't do the same surgery, obviously. They don't do a Deuk laser disc repair, but they do endoscopic spine surgery. And patients are awake, and unfortunately, they've had some patients being paralyzed from the surgery. So they've kind of stopped doing them, cervical. They've shifted over to fusions. So we're literally probably the only place in the world still doing endoscopic anterior transdiscal surgery like this. I was trained by the Koreans many years ago. Can you see this?
Yes, we can.
So you can see his chin with his beard, and this is the left side of his neck. We went in through the front. The incision is quite literally 4 millimeters long. Is that a good one there, Hen?
Perfect.
All right. No bleeding, like literally 1 drop of blood. There's no other surgery in the world that gives you 1 drop of blood and fixes a herniated disc. And it's outpatient. He's going to go back to his hotel in 1 hour. That's thanks to his awesome anesthesiologist, Dr. Berndes, the man, the myth, the legend. Any other questions?
Yes, we have a couple questions.
Oh, all right. So go ahead and I'll come answer them for you face to face in about 5 minutes. Let's go ahead and show the audience one of our patients who have had the surgery done before. And good morning, I'm Dr. Deuk, CEO and founder of the Deuk Spine Institute. I'm here with one of my patients who's traveled far to come to Deuk Spine Institute, all the way from Michigan. What brought you from Michigan to Florida?
I was scheduled for fusion to have just my one disc, C5-C6 fused. I'd had disc herniation before in my lower back, had it done. I didn't want to have to go through that again. So I did some research, found you had a good record. Your history is impeccable, so I decided to come down here and have it done.
Well, you didn't have a fusion though. You had something else done.
Yeah, I'm sorry. So instead of fusion, instead of going through and the complications and risk of fusion, lack of mobility, I wanted to have laser. I talked to somebody in Mexico that had laser surgery, and she said it worked great. So I thought I'd pursue that avenue, and that's when I kept Googling and searching and trying to find the right place. Some places had bad references. You had impeccable record, so this is why I came here, and I'm glad I did.
Yeah, so you were recommended for fusion by another doctor, and let's talk about that for a moment. They were going to fuse one disc, right? Number 5-6?
Correct.
Now, if you go to your surgery video here, you could see that we made a tiny 1/4 inch, 4 millimeter incision, and we fixed 2 discs, not 1, but 2. And it turned out that the disc that you were not going to have fused was actually the worst one. It was the one that was causing the vast majority of your symptoms. And the reason I'm talking about this is it's a common problem. It comes down to being misdiagnosed. And misdiagnosis happens all the time, all over the world with spine problems. And that's what we're trying to fix, is not having patients get the wrong diagnosis, because the wrong diagnosis will lead to the wrong treatment. Because treatments are always based on diagnosis. So if your diagnosis is C5-6 disc, the treatment will be fusion of the C5-6, but that's wrong because you had 2 discs that were problematic. We fixed both. You could see in that video, we were taking out lots of little chunks of herniation out of your C6-7 disc. Definitely needed to be done. How do you feel today?
I feel great.
Yeah, do you still have the same neck pain you had when you came here?
No, my wife can already tell that my shoulders are relaxed. My neck, I feel great, feel very comfortable.
And you had your surgery just 24 hours ago.
Yesterday morning.
Yep, and you can see you have a tiny 4 millimeter incision with a Band-Aid. No metal, no fusion, no narcotic painkillers after surgery. We didn't give you opioids, so that's another plus to the Deuk laser disc repair.
I agree.
Yeah, you don't need to be on powerful painkillers. You're back on your feet already, walking around, not in the hospital.
Yep, great. I'm glad I had a guardian angel looking after me.
You did have a guardian angel, and you're welcome. We enjoy helping people like you have successful spine surgeries. Is there anything else you want to tell your fans out there?
Basically, if you need the surgery, if you're having complications, neck, back, definitely come here. I don't care what it costs you for travel or whatever. You can't, it's worth, priceless.
I agree with you. It is priceless to get out of pain and have no complications from your surgery, and nothing bad that hurts you or harms you or changes your life in a negative way. So congratulations. And when do you guys head back to Michigan?
Saturday.
Saturday. So you're going to spend a few more days here?
Yes, sir.
What are you going to do for the next couple of days?
Well, we plan on hanging out in the sun, but
Yeah?
it's not the case right now.
I think, yeah, well, you could do. Oh,
I
yeah,
have
it's
got
just a
some
little
already.
overcast right now.
Yeah.
But this would be a good day for you to go check out the Kennedy Space Center. It's about 10 minutes away. They have all the displays and history of NASA, and it's really worth visiting.
I'll do that.
Save the beach for tomorrow.
There you go.
Sunny day.
All right.
All right,
Thank you very much.
congratulations. You're
Thanks,
welcome.
Thanks again.
I'm Dr. Deuk Machen, CEO and founder of Deuk Spine Institute, Deuk Joint Institute. I'm here with our patient from
Louisiana.
That's right. I had to have him say it. It sounds better when he says it. Why did you come all the way to Florida to the Deuk Spine Institute?
Well, about 3 months ago, I was scheduled for a cervical disc fusion in Shreveport, Louisiana. Had done all the pre-op stuff, was scheduled within 2 weeks to do the surgery, got to work and started doing some research. The more I read about what they were going to do with the fusion, people having trouble with it down the road, above and below the fusion, decided there had to be a better option. So that's when I found Dr. Deuk and his team and started watching some of his videos. Pretty impressive.
And you're a YouTube guy, you were
Yes,
telling
sir.
me, so you found us on YouTube. And what did you think?
Well, our first impression was any doctor that will put his livelihood live on YouTube, showing all of his surgeries, putting it out there, believes in what he's doing, that's not many doctors would do that.
Not just because of that, but because, afraid of complications, which, praise God, we haven't had a complication. We've been doing it now for 17 years. I want people to know there's a safer, better way to take care of their problem other than metal, fusion, stimulators. That's really the message there. You got that message loud and clear.
I did. My surgery was less than 24 hours ago. So far, the tingling, numbing going down my arm is non-existent. It's went away where it was there constantly all the time before. So hopefully this continues on.
Oh, it's gonna continue on. Our results are permanent with the laser surgery. And you can see your tiny little incision right there. It's a 4 millimeter. You can see we went in with a little tube into your disc. I was able to get both discs fixed. You had a lot of herniations in there. Something a lot of people don't understand. They think that a herniation is one piece, but it's about 30 pieces on average. And you had about 30 pieces in each of your discs. They were hard to get to, but we got it done. And I was very happy with the end results. We got all the pressure off the nerves, and we fixed the tear in the back of the disc. Less than 24 hours, here you are. You're doing fantastic. Now, what did your wife think about you coming down here to Florida? Was she supportive?
She was. This problem had been going on for many years. Started out on my right side years ago and had some stuff fixing that, but she knew the problem I was having. I'm very active. I'm a scuba diver, a motocross racer, do a lot of active sports, and she said, we've got to get this fixed. I'm too active still to actually quit all this. I don't want to quit, so this fusion just seemed like it was going to limit my options on doing things. So that's why we come down here. She was very supportive, and we decided to sign up and come on down.
What do you have to say to your insurance company? What do you want them to do?
I sure hope they pay, because I know they would have paid on the fusion deal, but why they would not pay on this, I don't know why, because results are immediate.
And no narcotics?
No, haven't taken a pain pill, haven't taken anything, nothing. Slept like a baby last night.
That's right. And after fusions, a lot of patients end up in pain management. They're getting shots, they're getting pills.
They can't talk, their esophagus is all tore up from them pushing it out of the way.
That's right.
And I have none of that.
Yeah, our patients don't go to pain management because they don't need it. Anything else you want to say to your fans out there?
If you are considering having some type of neck or back surgery, I think you ought to look at Dr. Deuk and his group, because they got a great facility down here, very accommodating. They'll help you with travel, whatever you need. We flew down Sunday, today's Wednesday, and we're going to stay till Sunday. Enjoy a little bit of Space Coast. Hopefully get to see a rocket launch here on Friday morning.
That's right. You can see the rocket launches from here and feel them. All right, sir. It's a pleasure.
Thank you, sir.
My pleasure. You have a great day.
Okay.
Let's get you guys out of here. You got better things to do than to sit in a doctor's
Exactly.
office. Wow, what a testimonial from one of our patients. I get a lot of requests, Dr. Deuk, can you give us longer term testimonials? I can't. I can't ask patients to do testimonials after they've left. It's not really feasible, and it's not really something I think is an important investment of my time. When you have the pain relief immediately after surgery, it's durable, it's legitimate, it's, you know, what people experience, and then they go off and they don't have problems. If they did, they would be letting me know, and we would be dealing with it. About 10% of our patients do have other areas that hurt, and they call us up and we address them, and we could usually do that over Zoom, where we can identify what's going on and what needs to be fixed. Remember, there are 30 completely separate individual causes of back pain. There are 30 causes of neck pain. And each one of them has to be looked at individually as, is this potentially causing the pain? And it has to be ruled in or ruled out. So what we do is we use the physical exam, which can be done mostly with Zoom, and we do the history and we do the MRI. We look at the actual MRI itself to help us see if there's anything like tumor, fracture, infection, herniated disc, bulging disc, annular tear. And then, of course, sometimes the MRI can be helpful with the facet joints to see if they're abnormal, have some fluid in the joint, which could be inflammatory fluid, giving us a clue that those joints could be the cause of pain. But the diagnosis of pain is mostly clinical, but it's supplemented with diagnostic imaging and history. That said, this patient here came from California. He has a single level disc herniation. And if you saw it on the MRI, most doctors would look at it and say, yeah, it's small tear and bulge, but that's all. What the doctors don't understand is that is the source of his pain. And once you fix that disc, the pain will go away completely and permanently. So your choices for fixing it are threefold. One, by the way, threefold means three things that could work if done properly. One is a fusion, where you would go in and clean out the disc and put in little cages between the bones and a metal plate. Nobody wants that. Number two would be an artificial disc, where you basically clean out the disc and you put a metal disc in there. Nobody wants that. I have one of those laying around here somewhere. And then the third and final way, which is the best way, is what we just did, which is to basically stealthily, with a ninja team, go inside and repair the disc with a laser endoscopically, and use the endoscope to find the tear and the herniation, because the herniation stains blue. Usually if it's fresh, it'll stain blue with the dye that we injected. You can see that in the foramen. By the way, this is an artificial disc, a metal disc. The problem with these artificial discs is they fail, they pop out, they erode the bone, they cause bone spurs to form, and they cause pain to continue, and then they cause adjacent segment disease, and they have complications. So scar tissue, esophageal injury, difficulty swallowing, hoarseness, recurrent laryngeal nerve injury, sympathetic nerve injury, sympathetic trunk injury, Horner syndrome, muscular damage, and of course injuries to the carotid jugular vein, esophagus, trachea, and the vagus nerve. So there's a lot of potential for injuries with open surgeries like fusions and artificial discs. But these are two of the options for getting rid of pain from a disc. The third is what you just watched. It is by far the best option. There is nothing that comes close. The fusion doesn't come close. The artificial disc doesn't come close. They're so invasive. They require fusing bones and putting in metal, and it's horrible. You don't want that. Bleeding, scar tissue, long recovery, hospitalization, complications. With the laser surgery we just performed, it's in and out quickly, 30 minutes, and you're home. And there's no metal in your spine, and guess what? You get to keep that natural movement of your disc. Totally natural repair. This is the future of spine surgery. You're just seeing it for the first time here at Deuk Spine. Someday this is what everybody in the world will do. Now, the Deuk laser disc repair is the best of endoscopic spine surgery. But there's other types of endoscopic spine surgery below it that don't work as well, and that cause more damage and destruction. And then there's the metal surgeries where you implant things, right? So you've got artificial disc infusions, you've got endoscopic spine surgery, and then at the best of the endoscopic is the Deuk laser disc repair. That's why we do it. We can do any spine surgery in the world here at Deuk Spine. We choose to do the Deuk laser disc repair because it has the best results, it's the safest, it has the fastest recovery of any surgery. The least amount of bleeding, scar tissue, the list goes on. There's no need for post-operative narcotics or opioids. If you get a fusion done, if you get an artificial disc done, you're going to be on Percocets or oxycodones or oxymorphones or whatever, some kind of toxic drug to your body, dangerous drugs for weeks after the surgery. With the Deuk laser disc repair, there's no post-operative narcotic painkillers, period. All right, we'll take our first question.
This first question comes from Injustice for All on YouTube.
What a surprise. Welcome to our live stream, Injustice for All. Thanks for being here.
They asked, good morning, Dr. Deuk.
Good morning.
Are you familiar with septovation endoscopic technique created by Dr. Michael Schubert from Munich? If so, what do you think about it?
Am I familiar with the septovation endoscopic technique by Dr. Michael Schubert from Munich, Germany?
Correct.
Nope, I gotta go look that one up. So I can't really comment on it.
And next question comes from...
I like the fact it's endoscopic. I'm not sure what the septovation is.
I have no... you put like the trademark, like the R to it, like that's copyrighted, but no.
Yeah, look, I'm never going to discredit a surgeon who copyrights or register marks their procedure. I think that's fine. There's nothing wrong with it. The fact of the matter is, and this is true for any surgery, if I do this fusion right here on somebody, it's going to be different than any other surgeon that does a fusion. Yes, the name is a fusion. Yes, there's a metal plate. But the plates are different, the cages are different, the surgical technique is different, the access to the spine is different. There's different amount of bleeding, a different amount of trauma to the soft tissues, different complication rates. I mean, the fact is that every surgeon's results are honestly somewhat unique to that surgeon, okay? You're not buying a car where they're all manufactured by machines, where they're made exactly the same from the same molds. The surgeons out there are all different, and their technique is different, their surgical technique is different, everything is different. You are never going to find identical surgeon doing the identical surgery, two of them on the same patient. It's always going to be different. So what matters is you got to trust the reputation of the surgeon and their company. And that's something I promote all the time on social media, YouTube. Do not choose a surgical technique or a surgery. Choose the surgeon and go with the best results you can get. You want get rid of pain, no complications, immediate recovery, immediately return to work and other activities. That's the Deuk laser disc repair. There is no surgeon or surgery in the world better. And if there was, I'd find it and I would mimic it. And honestly, there's nobody in the world that comes close to these surgeries you're seeing right now. This patient, we just did surgery on 1 drop of blood. There is no surgeon that gets 1 drop of blood, period, besides me. Number 2, he's going to go home, back to his hotel, in about 45 minutes to an hour. You cannot go home from spine surgery faster than 1 hour. There's nothing faster. Not real spine surgery done on the disc, where you're actually removing herniation and fixing the tear. So you can't do better results, you can't do less blood loss, no post-operative narcotics, minimal to no post-operative pain, Band-Aid incision, I mean no scar tissue, no muscle damage, no complications, immediate recovery, go back to work tomorrow. So if you look at all the boxes for spine surgery, we hit every single one of them with these procedures, the Deuk laser disc repair. So there may be another doctor doing endoscopic surgery elsewhere. I'm interested, I'll look him up, see what he's doing. I'm curious to see what he's treating. But there's an old saying, if it ain't broke, don't fix it. And if we have the best treatment in the world right now, I'm not going to change what I'm doing just because somebody else has another surgery with a different name. If it's better than what I do, I'll adopt it. I'll do it. But if it's not better than what I do, I'm not going to adopt it. If parts of it are better than parts of what I do, I'll adopt those parts. I'll incorporate them into what I do. That's what a good doctor does. They're always looking for a better way to do things for their patients. And the truth is, I've been searching now for 26 years for better ways to do things. And if you watch what I do, if you go to my YouTube channel, you'll see we used to do a lot of fusions. Now we've moved away from them. So we've evolved. Our technique has evolved at Deuk Spine Institute. What you can count on and hang your hat on is at Deuk Spine Institute, we're going to do the best spine surgery in the world, whatever that is. And if it's a different name or a different technique, we will adopt it, we will do it, we'll offer it to our patients.
Next question comes from Jamie on YouTube asking, can you fly after surgery or is it better to drive?
So Jamie, I assume when you say after surgery, I assume you're talking about the surgery we just did, the Deuk laser disc repair. I don't know what surgery you're talking about, but I'm going to assume for a moment it's the Deuk laser disc repair. Yes, you can fly after the Deuk laser disc repair, as in you can fly tomorrow if you have it today. I don't really encourage people to fly home the same day of surgery, but they could. There's nothing that would stop them. You can fly home today in the afternoon, but we want you fully awake and normal before we discharge you, which usually takes about an hour to 2 hours maximum. Depends on the patient, the amount of anesthetic, how fast they clear it. But you could fly today. You cannot drive today. You can have somebody drive you. Now tomorrow, the day after surgery, you could actually drive a car. You can drive yourself home. Which is better? Honestly, we have patients do both. I don't think one's better than the other. Whatever the patient is most comfortable doing, they can do. But after the Deuk laser disc repair surgery, you can drive tomorrow and you could fly today or tomorrow.
And next question comes from RJ on YouTube.
Hello, RJ.
They ask, what is your opinion on stem cell therapy for herniated discs after an operation like this?
Yeah, we get this question a bit, RJ. There is no need for stem cells after a surgery like this. It's a great thought. I give you credit for that. We tried it years ago, and it was not good because stem cells promote inflammation. That's what they do. So we tried doing the Deuk laser disc repair. We put the stem cells in. This was probably almost 10 years ago now. And the patient had, of course, what you expect, which is inflammation. And they had a lot of pain after the procedure. And so we've tried it. I do not recommend it. I do not think it's of value or help. But if a patient came to me and said, Dr. Deuk, I'm only going to do your surgery if you put stem cells in, I would have a conversation with the patient. I'd say, look, I don't think you need them. I think it's a waste of money. I think it increases the risk of complications for you. I don't think it's going to help you at all. But if you are adamant about having it done, I think it's safe and we can do it, and I'll do it. So I would do it as long as it was safe for the patient, doesn't increase too much risk, but they're going to have some pain afterwards they wouldn't normally have. So is there a benefit to it? In my opinion, no, but what do I know? I don't know everything. I'll be the first to tell you I don't know 100% on stem cells for disc. Now I can tell you if you do stem cells in a disc, just like somebody has a herniated disc, go stick some stem cells, that's a bad idea. It doesn't work. You can get an infection in your disc. It can create problems for your disc. The best treatment in the world for a disc tear, bulging disc, herniated disc, ruptured disc, slipped disc, protruded disc, extruded disc, is the Deuk laser disc repair. There is nothing better. It gives you permanent relief, and it's immediate.
This next question comes from Steven, once more on YouTube, asking, good morning, Dr. Deuk. How far out are you with scheduling? I'm currently working with Becky and workers' comp on my surgery. I'll be in Boca, that's where I'm from, for the holidays, and this would be the greatest gift ever.
Well, Stephen, I would love to be able to take care of you. I do know that I will not be here doing surgery from Christmas to New Year's. So in between Christmas to New Year's, I'm not available, but I'm here ready to help people. I know that we are absolutely chock full of cases this week. I haven't looked at next week's schedule, but my advice to you is do what you can to get on the schedule as soon as possible. We actually have too many surgeries on Thursday. We're going to be here late, and that's fine. I have no problem. being here late because people want to get fixed, and I don't blame them. So Thursday is going to be a busy day, and I even had to overflow cases to Wednesday, which is tomorrow. We're going to be doing a piriformis release tomorrow on a patient, and we're going to record that. Yeah, we're going to record it. I don't think we're ready to live stream. It's still too early on our piriformis releases to live stream them, but we are going to record it, and we may make it available. We've started doing piriformis muscle releases for people with piriformis syndrome, which is a big common cause of back pain, by the way. Very common cause. Lots of people have piriformis syndrome, and we try injections often. The injections work, but temporarily in some patients. Some people go on needing to have the release done. So we'll be doing that on Wednesday, which is tomorrow, Dr. Patel and I. And today, we've got 3 more surgeries, all lumbar. One of them, we're going to do a DPR on a toe, a Deuk plasma rhizotomy on a toe, a patient with severe toe pain. She's here for her lower back. We'll do her lower back discs, but she also wants me to fix her toe. Her toe is just so big, the joint, and she's in so much pain. We're doing it for free for her. I told her she's a guinea pig. We don't know if it's going to work or not, but we're going to give it our best shot. So just talk to Becky and Richard. You'll get an idea of when you can get scheduled, but it should be within a few weeks.
Next question comes from Rick on Facebook.
Hello, Rick. Facebook. Thanks for joining.
They ask, how much can you charge people with no insurance? Just curious, and also, do you take Medicaid? I am in the New York State.
Well, Rick, how much can you charge people with no insurance? I don't know what that question means. But we do offer discounts for people with no insurance. We offer discounts. By the way, we get a lot of international patients. They don't have American insurance. So we take cash. We don't take Bitcoin or any other cryptocurrency. And it's not because we're against it. It's just we have no way to take that money and convert it into paying our staff, basically, paying bills. Yeah, so, if there was a way for us to cash it right away, we would do it. And of course, we'd give credit for whatever the cash value is at the time that it's converted. But anyway, for people that don't have insurance or we don't take their insurance, we have a self-pay, it's called a self-pay rate, where we give you a discount off the full charge so to try to make the surgery more affordable. I don't know what the exact amount is, but it depends on what you're having done. So if you're having done cervical, it's different cost than thoracic than lumbar. So it depends on the area of the spine, but also, are you having 1 disc fixed or 2 discs or 3? Because the more discs you have fixed, the more money it is. And then, of course, in the lower back, if you're going on both sides, it's more expensive than just going on one side. So all surgeries in the world are priced out based on the amount of time and effort and supplies and risk that the surgeon is taking, or the facility actually is taking, because the surgeon's fees are not much. My fees are 5% of the cost. It's what my charges and payments are, very minimal. Most of the money goes to paying the facility, which is ridiculously expensive to run. And that's our government with all of its regulations. And it's a lot of corporations that are greedy. And they all basically charge obscene amounts of money for supplies and equipment that we have no control over. We try to keep the costs down, so what we pass on to the patients is as little as possible, but we won't compromise on quality. So there's a reason why spine surgery is very expensive. We call it resource intensive surgery.
And then last but not least, we have a question from RJ on YouTube once more, asking, do you have any Christmas sales available onto herniated disc with cord compression? I am paying out of pocket, and insurance will not help me from Canada.
Yes, we definitely have Christmas sales. I don't know if you've already done your MRI review or not, but if you've done an MRI review and you have your scheduler, if you have a scheduler, that person is the person you would ask about the Christmas sales. And I would expect them to give you a Christmas sales discount. So tell them Dr. Deuk says they have to.
And that is it.
All right. Well, thank you so much for the questions and the involvement. We're done with this patient's surgery. He's going to be basically going home in about 30 minutes. I'm going to go check on him right now, see how he's doing. But that said, our next patient has 4 discs that are being fixed in her back and facet joints. So she's got, I think we're doing like the right L3-4, maybe bilateral 4-5, and then maybe 5-1, I'm not sure.
I think 4-5 right.
All right. So we've got several different spots in the lower back for back pain, and then we're going to be doing her rhizotomy here at L3-4, Deuk plasma rhizotomy. I will say this patient has had disc seal procedure done, which did not work. So people ask me all the time, what about disc seal? What about disc seal? What about barricade? My opinion, they're garbage. They'll give you some temporary relief because what they do is they put some steroids in there, and the steroids make you feel better. Okay? But it's a sham procedure in my opinion. I would not perform it. I don't recommend it. It doesn't work. It doesn't give long-term relief. Well, let me just say that disc seal versus Deuk laser disc repair. The Deuk laser disc repair gives you permanent, long-term, the rest of your life pain relief, like 100%. Our average is 99.5% elimination of disc pain. Disc seal, most patients don't get any relief. Some get short-term because they put steroid in there with the stuff, and then some get a little bit of improvement that lasts maybe for 6 months to a year. But the point is, it's, in my opinion, disc seal is not worth doing, and I don't recommend it to patients. So this next patient is a disc seal patient. I did not do her disc seal. Somebody else did, and she's here now having Deuk laser disc repair because the disc seal didn't work. What's going to be interesting though is when we get inside that disc with the disc seal treatment, when we get inside, I have a feeling we're going to see more scar tissue in that disc than we would normally. So I'm kind of curious to see what does that disc look like